Did you download the photo? So if I stop sharing. Morning, everyone, or happy lunch. Thank you for being understanding with me running a little bit late today. Kim's here again joining us. At the end of today, Kim's going to share a few photos that Chelsea Marie has sent through just for a little bit of guidance. And I think I had some, I think it was from Danielle. I'm not sure yet. I'll wait for her to come on and see if she's happy for us also to share those pictures, and we can go through some little case studies together of what we think will work and not work and how we treat them. So Chelsea, if you prefer me not to bring up the pictures and talk about it, just pop it down in the chat if you don't want me to, but if you are happy to and we have time at the end, then we can go through those as well. Again, my apologies for running late. The Meso Pen Pro webinar that a few of you were on did run a little bit late as well. So I apologize for that. But I think that we are all here now. So we'll get started. But does anyone have any questions from last week that you would like answered or still some more clarity on, something that you're not sure with? Happy to go back over it. So if you have any questions before we get started on this section, let me know. So we covered the overview of Lynton, why it's so unique, consultations. We went back over pigmentation, sorry, not pigmentation, that's today. We went over hair removal. We went over test patching, so hopefully everyone's really clear on test patching now in their consultation procedure. If you still have any questions, pop that down. But if not, we will just get started. And like I said, we'll do Chelsea's case studies at the end. And Danielle, I know you've just jumped on. Denise did share some pictures of your client to me. If you're happy for me to bring them up on screen, we can also go through that. Otherwise, I can come back to you individually, but just let me know in the chat and we can do that at the end as well, please. So let's get started on skin rejuvenation treatments. So who's doing skin rejuvenation at the moment? Who's been doing your Illumis? Who's doing a standard skin rejuvenation? Let me know what you guys are currently doing. Are you doing more 650 or are you doing more 585? Are you scared of the 585? So let me know all of that. And that will really help me being able to customize this a little bit more for you in doing these treatments. So while I just wait for everybody to tell me what you're doing, I really want to be able to make sure I can maximize what we're learning for you guys and really take that to the next level. Because I know you all have been doing it, your treatments for a little bit now, and you're wanting just that little bit more assistance. So let me customize it for you. And I've just had all these pop-ups on my screen and I'm trying to clear them all. Okay, perfect. All right, so doing both 650 and 585, perfect. All right, so let's have a look at aging skins. So when we have a look at aging skins, and can everyone see captions at the bottom of the screen? Because somehow I've turned captions on and I don't know how to turn it off. Okay, hang on a sec, because that's going to really drive me nuts. Kim, do you know what I've done? Just having technical difficulties. I went there. Oh, captions. Turn them off. Sit down. All right, I don't know what I've done, guys. Or restore defaults, maybe. Okay.
Everyone can also hide the captions.
Sorry, guys, there's captions going for everyone at the moment, so we'll see what it translates for, if it translates correctly or not. I don't know. I've never been able to do it before, and not, of course, now I've done that. So, okay, so let's have a look at what we're going to be able to treat with our skin rejuvenation. Now, I love this picture of this wrinkled lady. Now, as much as she needs skin rejuvenation, I think that she's probably out of our scope here. And if everyone will agree, she's definitely too tanned. So we will not be treating this client. But prevention is better than cure. And we always want to make sure our clients are wearing an SPF. So SPF is so crucial. So please make sure if you're doing any treatments that they've got the SPF on. And if they're not wanting to use an SPF, especially after their treatment, they're not the right candidate, because they're not going to get the results. We're going to have adverse effects, and then it's just going to come back anyway. So, but I know you all are really good with that. So let's have a look at what factors affect skin rejuvenation. So we have a look at our vessels, our pigment, and our collagen remodeling. And these all require typically different wavelengths, especially if we were doing a laser treatment like we discussed last week. But we want to target here our hemoglobin or our blood, our melanin, and our water and collagen in the skin. So we want to make sure that we've got that correct handpiece to be able to do that. Now, if we were looking at lasers like we spoke about last week, you would need a different laser for each individual one, and we've got the different wavelengths there. However, when you're working with IPL, remember we've got that broad spectrum of light in there, and we use our filters to narrow that down. We can actually get that one beautiful little sweet spot with our IPL, and we can treat all three wavelengths with our IPL treatment. And we'll talk a little bit about the Illumi and how amazing that is and how we're going to get those results for your clients. So we know on our Exolite device, we have the 585 handpiece for rejuvenation, and we have the 650 for rejuvenation. Does anyone still get stuck on which one I would choose for which client? Would I choose the 650? Would I choose the 585? Which one do I start with first? Which one do I go to next? So let me know if you're still getting a little bit confused, because sometimes the 585 might be fantastic for them and that's where we want to be, but maybe we want to start with the 650 handpiece first, do a couple of little sessions on the 650, mop up a lot of that color, and then we can work and being more collagen stimulating first, and then work with our 585. So when we're choosing our 585 handpiece here, we are going to help more with color correcting, okay? So 585, think of this as your color corrector. So we're going to be able to help with pigment, vessels, general sun damage. It is a lot more aggressive than your 650. So if you have someone who has a lot of color and has a lot of pigment, has a lot of vessels, just be cautious, because this could be a little bit too bitey for them at the beginning, and you might want to start with your 650 first. We also do not use our 585 on skin types 4 to 6. So it's strictly 1 to 3. So if you have skin types 4 to 6, but you still want to do a skin rejuvenation on them, yes, you can, but do it on your 650 handpiece. And we actually were doing some training the other day, and we have our lovely Kim, who is that higher sort of Fitzpatrick. She's at that 5. And we did a beautiful Illumi facial on her with our 650 handpiece. handpiece and had beautiful results. Her skin was just, even though she's already young enough as it is and we didn't really have to help, we were doing more age prevention, but those results were phenomenal with the 650. So don't just think I need to go 585. The 650 handpiece is amazing for that. Now, if we look at what our 650 handpiece is going to do, so this is a more gentle one. It's going to work a little bit deeper into the skin. It's going to more work with that water in the skin and stimulate, put more bulk heating. And that bulk heating is going to stimulate those fibroblast cells. So it's going to stimulate that collagen and elastin. We're going to get that hyaluronic acid building in the skin as well. We're going to get that plumpness, that hydration. We're getting all that new collagen forming. If you've done an Illumi on yourself and done a 650, tell me the results you saw on your skin, because I love this treatment. I think it is just so amazing, even just like a little party treatment to have just before you, a couple of days before you have an event. Your skin's glowing, it's plump, it's hydrated. Now look, if you've got a lot of pigment or a lot of vessels, probably not your party treatment, but if you're just wanting it for some more mild stimulation of collagen, absolutely fantastic. And when you combine it with that peel that we use as well, the results are phenomenal. So this can be used on skin types 1 to 5. So we can really get that really good result for even those higher Fitzpatricks and be really safe and effective. Also fantastic at maintenance treatments. So if you've done all your treatments on your 585, you cleared up all of that color in the skin and you've made it more even, we've got rid of all of those extra vessels and that excess pigment, and now we want just more maintenance, we want to keep stimulating that collagen induction, then go your 650 after that. So let's have a look at the different hand pieces in more detail. So our 585 handpiece will improve skin texture and tone. Like I said, it's that color corrector. So it is going to pick up the vessels and the melanin. So it's looking at blood and melanin. So a little bit more aggressive and bitey. And although sometimes you think it's not going to be too bad, when you really feel it, it is that little bit bitier on the skin. And it does give you that little bit of that punch. Like it does sort of, you do feel it because it's picking up all that extra target. And that target is what is making it that little bit more aggressive. And then if we go to our 650 handpiece, this is going to be more for skin texture, skin health, less aggressive. Remember, we're putting that bulk heating into that skin. We're really helping to stimulate that collagen induction. So when you have this treatment done, it is more of just this sort of the feeling, it's just really mild. It's more the light is annoying than anything, than the actual pain of feeling anything in there. So you feel more of that or see more of that light and that discomfort from that light flickering than anything. And it's just that gentle warming to the skin. So it's a really nice treatment to have. Both hand pieces will do some lines and wrinkles. But if you've got those real deep wrinkles, those real static wrinkles, you're not going to get it with this. So that's when we need to look at more either the lasers or the microneedling of what we just discussed in the previous webinar as well. So we are stimulating collagen and elastin, but you have to look at what is your scope. So yes, you're going to be able to still improve, but those deep wrinkles, they're going to need a little bit more than what we're doing here. Again, like I discussed with you last week, I really want you to have your own explanations for your clients. So work as a little team activities in your salon. Everyone put together a little explanation of what they use in their, what they use to describe what they're doing, and then maybe tweak it. And it might be different for everybody because everybody has a different way of speaking and every client will understand different terminology. So it's really, there's sometimes that younger client are really savvy and really know what's going on. And there's other clients that are sort of like, oh, I don't really know those technical words. So you might have a different explanation between each one. But this is the one we've got here for our skin rejuvenation. So this treatment causes the skin to heat up and causes very mild reversible thermal damage to the epidermis. The skin acts to repair this by increasing the rate of collagen and elastin production deep within the dermis. This increases our skin elasticity and strength and making the skin look softer and smoother. Many people also see a more uniform complexion and pigmentation of the skin. So definitely we see that beautiful end result for our client. They've got younger looking, healthy, glowing skin. We've evened out that color, but it is plumper. It's more hydrated. You've got more collagen in there as well. So if we look at if we are doing a 650 handpiece, what we want to see in the skin, we only want to see a gentle erythema. That is it. We don't want to see any block marks. We don't want to see any real redness in the skin. It's just that slight pinkness that we want to see. Some people don't get anything at all, and that's okay. Some pigmented lesions, and a lot of you will have found this when doing your treatments at the moment, that when you do a 650, because remember we do 650 for hair removal, that targets melanin, doesn't it? So we can pick up pigment with this one. So it is important to note if there is any pigment on the skin, and that's why before and afters are so important, because sometimes you may not even see pigment on the skin. But once you go over with the 650, you're like, did that little area there darken? Is there a freckle that's come up? So really have those before and after photos so you can see. So if an area has darkened with your 650, you will not go back over it with the 585. So if it has darkened at all, we leave it. It's already done its job, and that will flake away. So any of those pigmented lesions, they will come up darker and they will like speckle off, and we get what we call that miloing effect, and it will flake away off the skin. We do not pick or scratch them. Now, if we've got a 585 handpiece, we're going to get a bit more erythema in the skin. Pigmented lesions will darken, and they will could potentially get a little bit of microcrusting over the following days. So we don't want to see microcrusting instantly. We want to see it over the following days. And then vessels will either darken or disappear. So we'll talk a bit more about the vessels as well when we get up to vessels and what are those end results that we're going to see for those clients. But who loves seeing that vessel just completely disappear? I love it. I love getting my vessels done. It's nothing more satisfying. So if we have a look at our different treatment plans, remember you've got your protocols and you've got everything written on there for you as well. And these plans are also on the last column of your protocol chart. So don't forget, you don't have to remember these off the top of your head. They're on your protocol chart at every time. So if we're looking at a 650, we want to maybe do only 3 to 6 treatments. You may need more because it's a bit more gentle in the skin. So if you are looking for something a bit more gentle and easing in, you might want to do the 6 treatments. Because we're working on general, just putting that bulk heating into the skin, and we're not necessarily working at color correcting, we can do these every 2 to 3 weeks. So they can be a little bit closer together because we generally don't have to wait for the healing of the vessels and for all of the pigment to fall off, okay? And because it's more gentle. And then maintenance can be done every 1 to 3 months. Now, if we're looking at the 585, because this is so a little bit more aggressive and we're going to be able to mop up a lot more, we may not need the 6 treatments. So we might only need 3 to 5. And again, we would space these out further. So we're going to do 4 to 6 week intervals because we need to wait for all those vessels to heal. We need to wait for that skin to calm down because there might be some mild bruising, especially if there was some big vessels through there as well. But we need to wait to see what has completely cleared, because sometimes with pigment and vessels, it can take 4 weeks for that to completely flake off. It can take 4 weeks for that vessel to completely collapse and go away and go out through our lymphatic system as well. So we need that little bit of extra time for that to occur before we go, okay, this didn't get treated, I'm going to hit it again, because then we could over-treat as well. So we just need a little bit more healing time. And then maintenance could be just when necessary, or maintenance gets replaced with your 650 and just do our skin rejuvenation maintenance. Both hand pieces are going to give us fantastic results. It's just a matter of which hand piece is right for our client. And I think when we talk about those little clients conditions later and those little case studies, it's sometimes a little bit easier to see than just before and after on my slide. If we have a look at your real life client cases, then we might be able to map that out a little bit easier for you. Okay, so let's have a look at our Illumifacial. Now, I know a lot of you have fallen in love with the Illumifacial, and I think that's pretty much what you're all doing is your Illumifacial. But the Illumifacial is a combination of our Lynton IPL machine, but also our Lynton products. So we would generally start with our cleanse. We'll do a cleanse on our client. We would use our Lynton Trifruit Acid peel as well, which is an amazing peel. And it can be a little bit bitey on some clients. But then after we've taken off our peel, we will do the 650 rejuvenation all over. And then we would do a spot treat of our 585. And when we spot treat with the 585, it is a spot treatment. So we are using that small 1x1 block, and we are just going, okay, there's a vessel here, there's a pigment here, and we would pick maybe max 10 spots that we would choose. And then the rest would all be each time we do it again, then we would pick another 10 spots or so. So we don't want to then go back over and treat that with the 585 all over. It's too much. And then that's why we've got the series of Illumi facials that we can do to be able to do that. Some people might only do the 650 and they might not spot treat. So you might find you might not need to spot treat with a client, or that it did pick up with the 650 those vessels and then you don't need to do it. So have a look with your client. It's not always necessary to change to the 585. So when we're looking at why we're choosing an Illumi facial, we want softer and smoother skin. We want less visible pores. We want you to be more uniform in color. So we want really that even tone. We want to have that flawless finish. And I find sometimes after this treatment, you get almost that airbrush look to your skin and you want to feel healthy. So remember, we're stimulating collagen, we're stimulating hyaluronic acid, we're color correcting, we're getting all that cell nutrients up to the skin, we're putting in that bulk heating, we're getting all that blood flowing through the skin as well. So we're going to not only look healthier, but we're also going to feel happier as well. And remember, some fine lines and wrinkles may be improved, but not removed depending on how deep they are. So let's just touch on this because I know that a lot of you already know this, but let's just touch on our facial cleanser. So this has what we call a really sticky molecule. So that sticky molecule helps to bind all of those dirts, those impurities, those makeup on the skin, and helps to draw out all of those impurities. So safe to use around the eye area, completely safe for really heavy eye makeup, waterproof makeup. Sometimes even if you've got the white eyeliner on that you've charted out on this client's skin and you can't get it off, put a little bit of this cleanser onto a cotton disc and just wipe that area and it comes straight off. So it's really nice for removing that as well. And I use this as well after the peel to just make sure the peel is neutralized and completely off the skin. But safe to use on all skin types. It's a beautiful cream and it will really help to just give us that beautiful, nice clean surface to work with. Now, our fruit acid peel. So this is a 20% AHA formula. Now, I know it says try fruit acid peel, but it is bitey. It's got some good actives in there. So you got your glycolic, your malic, your tartric in here. There's a tiny little bit of salicylic as well. So this is really going to help to just give us that beautiful even surface. Now, I know a lot of you are like, why do we need to do a peel before a treatment? The main reason why we want to do this peel before a treatment is when we put a light onto the skin, and similar goes to when we do a Dermalux and we're putting LED onto the skin. If you have that light on the skin, but you've got all of these dead skin cells that are sticking up, none of them are laying flat, they're all over the place, that cell is going to then reflect that light and it's not going to be absorbed nice and evenly. So when we have that trifruit acid peel on, we're basically removing off all of that dead skin cell. We're really getting that beautiful clean surface, that flat surface of that skin. So that light is going to absorb evenly all over. Okay, so it helps to not reflect the light. It's going to absorb it much more effectively. Now, can you use a different peel with a Lynton product? The answer is no. So we haven't tested it. Lynton haven't tested it. And if you do it and something goes wrong, then we can't really assist because we don't know, was it us, was it the peel? It all needs to work together. So please do not use any other peel. If you do not have a peel, then don't do anything. Just do your Lynton treatment, okay? So please only use this one. All right, we have a stem cell serum. Now, this is all about, we always talk about stem cells, especially for those of you, most of you all have image that have our Lynton, so all of you are familiar with that. But we want to feed the skin with all the nutrients that it needs for beautiful, healthy cell function. So we have lots of different stem cells in here, or plant-based stem cells. They're going to help to support skin renewal, anti-aging, photo-aging. They're going to help to hydrate, cell metabolism, all of that that type of thing for all cell nutrition and all cell life extension. So this is going to really help to promote that beautiful cellular life. So this one is used at the end underneath your SPF. So you will use this one at the end of your treatment. It is also a retail product. So if your clients want to retail it, the cleanser, the serum, the light soothe, everything besides the fruit acid peel is all a retail product as well. So if you did want to have a little retail bundle for your clients, you can. Now, the Lynton Light Soothe, I love this product so much, and do not just use it just in Lynton products. So this is an amazing, think of it like, I know you've got like your laser aids or your aloe vera gels. This is next level premium up there with it. So this is all about calming, soothing, repairing. It also has a not only antibacterial, but it has a slight anesthetic effect in there. So it gives it that slight numbing effect on the skin as well. You've got your manuka and your panthenol in here as well to help heal and hydrate and protect the skin. But it's so calming and so take out that sting, burn, any irritation. So I know someone asked me the other day what they could put on their skin after a plasma treatment. And I'm like, use this. Like they had skin tag removal. And I'm like, this would be perfect for calming, soothing, and repairing. Post peel, if you've had a complication, this product. Post waxing, any type of burns or irritation, put this treatment on. I know during COVID, because Lynton sits on the NHS over in the UK, and they've got a lot of their machines out there and they're partnered with the NHS, they actually were giving this product to all the hospitals to put on their skin, their hands after washing their hands, because they had to wash so much. Everyone was getting like contact dermatitis and eczema, and everything was flaring up for them. So they were actually giving this to the nurses and doctors to be able to put on their hands to repair them during that time. So that was really powerful as well. But I do absolutely love this product. I use it all the time. It's like my go-to now. And then our daily defense. So this is an SPF 50. It's both physical and chemical in here. So it does give you that beautiful coverage and protection on our skin. It's thick, but it's not greasy, if that makes sense. So it doesn't clog, it doesn't irritate, and it doesn't feel like you have this thick sunscreen on. I know a few people sometimes like to use this as a primer under their skin, but a beautiful way to finish your services. And please make sure it goes on after every treatment before they leave your clinic, and then you can also retail them a smaller one as well for their treatments. So this is a great before and after Illumifacial they've had 4 treatments. Now, if you look at this client through here, look at those big pigment spots. So we've got rid of all of this uneven skin tone, that pigmentation through here. Now, you can see these vessels are quite deep. Now we've softened them, but we haven't removed them. So you can see that you can still get those fantastic results for your clients. And then if you wanted to work more on the deep wrinkles, you could potentially move on to something else like needling or RF needling, RF skin tightening, things like that as well. Now, also remember that if something does look a little bit sus or it is a little bit big, refer to a doctor first and get it checked if it's safe to treat. But I love these results. Fantastic. And I know you guys sometimes have even better ones of those before and after. So if you have them and you're happy for us to share, please share them amongst the groups. Now, this is after 2. Now, I know it does say Lumina, but the Lumina does use the 650 and the 585. It's just another one of their machines that they have over there, but it's still using both the 650 and the 585 handpiece. So you can see fantastic results. She's a darker fits. Now, they would have actually just used the 650 all over on this client and been able to pick up all of that pigment just with your 650 handpiece and not have to worry about spot treating with the 585. So fantastic results for this client. The tone, the texture, the health, the overall clarity of the skin is amazing. And this is after 3 treatments with our Exolite. So you can see there's a lot of redness in this skin. There's a lot of vascular activity. We've softened those lines around the eyes again, but they're not gone. But we look at the clarity of the skin. There's a mix of pigment. There's vessels, especially this big juicy vessel through here that has now completely gone with your Illumifacial, doing both the 650 and then spot treating with your 585. Now, this is just some other little examples of what you can see here. We've got a mix of pigment, vessel, skin tone, texture. Look at the lines around the eyes. This is also a great before and after, especially even around the mouth, the little lines around the mouth. Okay, so hopefully everyone's happy with skin rejuvenation. Like I said, I'm going to come back to it at the end with a couple of your case studies, but let's move on to vessels. So what we can treat with our IPL. So we can treat facial telangiectasia, rosacea, spider neves, Campbell-Morgan spots, or little cherry angiomas, they're also called, polypoidoma of Savate, and port wine stains. Now, polypoidoma of Savate's really hard to treat, and because you can see it here, it's a mix of both pigment and vessels. Generally it is from people spraying their perfumes on their skin, and then it's getting that interaction with the sun and the inflammation and everything like that. And generally it's white through here because this is always protected by the sun, and they usually spray here and here. So we can treat this really effective with an IPL machine with our Lynton. And the little cherry angiomas, I have so many of these all over my chest and my tummy. I feel like as fast as I get rid of one, another one comes up somewhere else. So these are always so fun to treat, and one shot will get rid of it. So you can effectively treat these in one treatment and not have to worry about that client coming back for more. Now, what we can't treat is we can't treat deep lesions, thick vessels, blue or purple vessels, varicose veins, or skin types 4 to 6, because that melanin, that pigment is just too high on the surface. And with the amount of energy we need to put in, we could potentially burn their skin, so we wouldn't. Now, the reason why we say no vessels below the heart. Now, cherry angiomas are different. You can do those all over the body, fine. But if it is more of a vessel, like a leg vessel, I get that question asked a lot, we can't treat those. One, they're just too deep in the skin and our wavelength is not deep enough to hit those. But also there are potentially so many feeders underneath that we can't see. So we will not get a result. We might help maybe collapse them a little bit, but we're not going to destroy them. They'll refill. So we don't treat anything below the heart. You will need an Nd:AG to go in and do those other vessels on the body and the legs. But cherry angioma is perfect. Okay, so let's look at how this is working in the skin. So our light is absorbed into the vessel, which will cause thermal necrosis, which will destroy that vessel. Now, when we put this little pulse into the skin, you can see that it destroys it and breaks it up. Now, sometimes we can completely destroy it and break it down and collapse it all. And sometimes we just reduce it and it may get smaller, and then we need another treatment. So we typically say 1 to 3 treatments for a vessel, because we may be able to destroy it in one go. It may be quite large and we can't see how deep it is under there. It may have a feeder, or we may have shut off some of it, and then it's getting that slow refill coming through. So that's why we usually say 1 to 3 treatments. So our light is going to heat up our vessel, which is going to either cause it to instantly collapse and what we call blanching. So you'll see it just disappear, or it will coagulate and go darker. Both are acceptable, and we want to see one end result for them. So that's why we never shoot it and then go, oh, it didn't happen, and we shoot it again, because sometimes it can slowly just blanch and disappear, and sometimes it can slowly darken, and it's coagulating and it gets darker and darker and darker, and then you're like, yeah, I got you. So that can take sometimes a couple of minutes. So always just treat a vessel, wait, maybe go to a different vessel and then have a look, and then maybe just wait on that first one, because you might have to go, oh, maybe I do need to put my settings up for the next one because it wasn't enough to get rid of it. So we don't shoot it, put it up, shoot it, put it up. We want to wait and assess it and see how it goes. If we're unsure if we got that first one or not, we'll just make a note of it down in our record chart And then when we come back for our next treatment, we'll go, okay, that needed a little bit more power. It's still there, or maybe it only half shut down. All right, so overall, the following 1 to 3 weeks, we're going to see that is going to naturally be absorbed by our body. So our body is going to absorb that if it's coagulated lesion, and it's going to then be flushed away through our lymphatic system, and then we're going to build a nice new network of strong capillaries underneath that are going to be nice and healthy and strong. That's the other reason why, like I said earlier, we want to wait that 3 to 6 weeks, because we need time for that vessel to fully shut down, heal, and go away, and we've got those new strong, healthy ones. Now, some of the different reactions that we can see. So we can see a grey coloration or darkening of our vessel. So this will indicate it's coagulated. We could get a blanching or disappearing of the vessel. We could either get a slow or no vessel refill. So sometimes you see it disappears, but then it slowly comes back. And maybe we've only partially shut it down, or maybe we've partially collapsed it. So that may need another go over next time. And possible bruising, but rare. Now, I know when the girls do my vessels, I think Kim and Rachel had a little bit of a freak out that they had burnt the boss and they were like, oh my God, what have we done to her? But I do get a lot of swelling on my vessels, especially just through here on my cheeks, just on the outer side of my nose. And they do swell up quite a bit, and it almost looks like it goes a bit grey and it goes swollen. But then I just put a cool pack on it, and within about half an hour, it's completely gone. But that's my body's response. So I do get that slight swelling, and I do get, it's kind of like a bruise, but it's not a bruise, it goes away. So that is really normal. And especially if you're doing like a really big juicy vessel and maybe they have a more thin, fragile skin, you will experience that slight more swelling, as long as it's a swelling around the vessel and not a swelling around the block. So if you have a big block that is swollen and it's a square, that is more of a burn. But if it is just around the vessel itself, then that's okay. And some erythema is very, very normal around a vessel, because remember, it's almost like the feeling is like an elastic band flicking against that vessel. I think a vessel is quite painful sometimes, but you do get that erythema around that area if you have successfully treated it. Remember, it hurts a little bit more because the target is so superficial. It's so high to the epidermis that it does. You do need to put quite a bit more energy into it to get it. And because they're so thin, you need that higher energy because that vessel is so thin. Okay, so our number of treatments required are typically 1 to 5, depending on the lesion. If you are doing something like rosacea, though, you will need many more. So you might get 5 to get it under control, but then if they have a flare up, then it's going to need another session or a couple of sessions, or sometimes it may only be maintenance for them, depending on what their trigger is and if they know their trigger, because we can't stop their triggers. There's still no real known cause of rosacea. So we can help control it, but we can't cure rosacea. And then treatment spacing is typically every 4 to 6 weeks. So this is a rosacea client, and this is after 3 treatments. So fantastic, phenomenal results after 3 treatments here. You can see a lot of them, there's lots of feeders through there as well. And I think that's the thing that the girls realized on me, is they didn't realize how many feeders I had underneath, and they could just start to see when they pulled the skin, there was another feeder going underneath, and there was a bigger feeder over here. And so that's a lot of the reason why I constantly keep having more vessels coming through, because I've got so many feeders around that are filling those vessels, and they're hard to shut down. So this is fantastic after 3, but then we will need some maintenance with this client as well. This is before and after 4 treatments. So you can see with that telangiectasia through there, it's really tightly bound together. it is going to be painful. Like this will be painful. So what I would do with this one is, and remember with vessels, you need to be really cautious with the amount of cooling and pressure you use. So if you do too much pre-cooling, what's going to happen? You're going to get rid of that blood flow, right? If you put ice and too much cooling on there, you're restricting that blood flow. So you then will have no target to treat. And that's sometimes why a lot of you will go, I'm not getting good results in my vessels. So you're putting too much cooling on there and you're reducing that blood flow, so there is no target. So if you do want cooling, just get maybe a cotton round in some cold water, and I would just place it onto the skin and do 1, 2, 3, zap it, and then post-cooling. Lots and lots of post-cooling. So try that. Maybe just try even cool gel. I always put my gel in the fridge, so that way the gel goes on nice and cold, and that's already acts as a pre-cooling method. Now, the other reason why you may not be clearing your vessels is you're using too much pressure. So if you have put it on the skin and you're putting too much pressure on, then what happens is you're again restricting that blood flow. You're pushing it in and you're pushing that blood away. So there's actually then no blood in that target zone. So then you get no effect or very little effect. So make sure your pressure is just light. Sometimes it's just touching or hovering even on the skin. Now you want to use a good amount of gel, but you also don't want it to be too thick, because if you use a really fat amount of gel on there and it's got so much, that light is really not going to be absorbed into the skin very well. It's going to be diffused through all that gel because it's trying to get through it. So use some gel, but don't have too much gel on there as well. So try those little tips and tricks if you're not getting it. Sometimes as well, if you're doing the nose and you're pulling the nose, you're restricting that blood flow when you're stretching. Okay. Now this is a spider neve. So this is after one treatment, very successful with one treatment with these. So fantastic. As long as you got that right setting in that parameter, you can really get these in one treatment, which is fantastic. Now this is a port wine stain, and I'm going to start to add, I haven't finished off Shelley's treatment yet, but we do have one of our girls in here that we've been doing a port wine stain for her in her forehead, and it is absolutely amazing, the before and after on this one. It is just life-changing for her. So this is after before and after 4. Now, these are painful. So I don't know if anyone has tried to treat a port wine stain. If you have, let me know. I would love to. Kim, just let me know if anyone says that they do. But port wine stains, they're so satisfying to treat us as a therapist, but also to see the joy on the clients' faces at the end of it. And I know we're scared of this, but these can be extremely painful. And the reason why is because there is so much of tightly bound vessels that are all interwoven together that form this, this network. And a lot of the time, these are swollen as well. They're quite they're raised on the skin. So when you treat these, they can darken instantly, and you will see it almost go like this really dark brown, and they all coagulate. It is really painful, and it can be quite uncomfortable for the client. So after you do it, please make sure you've allowed enough time in there to do lots of post-cooling. Post-cooling on a vessel could be the difference in pigment as well, could be the difference of a burn and not a burn. So as well as just also calming and reducing that discomfort for that client. So when I do the port wine stain in here, we actually post-cool for about 20 minutes afterwards. And what we'll do is we'll get a bowl of really cold water, and we get either gauze or a cotton disc, and we put it in there to get nice and cold, and we place it over that area, and then we leave it for a couple of minutes. You'll find that it will heat up, and because it will be absorbing all of that heat onto there, and then you replace it with a new one. So have a couple going, and then you'll put the next cold one on and put the other one back in, and you'll just keep replacing those cold cool packs to keep cooling it down. And that will just be a game changer for your client and help reduce any complications that you may have for your client as well. Try not to put ice directly onto it. It's a little bit too much and can result in a little bit of an ice burn. But these need anything from probably 4 to 8 treatments sometimes. You will find as well sometimes, like there's been amazing clearance on that. You can still see there's a little bit of redness through that area. I've lost my mouse. There it is. You can still see a little bit of redness through there and there, but the majority of it's gone. So you might not get 100% clearance on a port wine stain, but it is enough to be a complete game changer to a client. Kim, was there any questions? No. Okay, cool. Okay, so this is another port wine stain. This is after 2 treatments and then after 3 treatments. So you can see how tightly packed those vessels are in that, in both ones actually, in there. And we really need to slowly break that down. Now, what they've done is this bottom one is really a large port wine stain, and it is so traumatic to do that whole area at once. So they've chosen to do it in sections. So then we just do it. It's a much more comfortable treatment just to do it section by section, sorry, to get that result for that client, but also maintaining that comfort for them. Okay, so before we move on to pigment, has there been any questions on rejuvenation, vessels, anything like that? Anything I need to go back over?
Everyone's got it.
Perfect. All right. So what we can treat with our IPL with our 585. So we can do freckles, age spots, liver spots, sunspots. What we can't treat is we can't treat moles, melasma, cloasma, post-inflammatory hyperpigmentation, and anything bigger than 6 millimeters in diameter that has not been checked by a doctor. So if it's been checked by a doctor and it's completely fine, yes, we can treat it, but we need to get it checked out. Now, for those of you, just to recap, we can't treat melasma or PIH in the skin. Now, melasma is a inflammatory condition that's causing it. So it's usually caused by heat. So inflammation, heat triggers inflammation. Inflammation will trigger the melasma. And if we do a client with melasma, what's going to happen is we could get a result than that first one, but then it'll come back with a vengeance. And so we don't want to do that because we are causing that extra trauma into the skin. So we do no heat-based treatments with melasma. And I know, Chelsea, you're probably going, yeah, and rolling your eyes at me again. But we don't want to cause any extra trauma to your client's skin with doing this. Now, if they've got melasma on their face, but you want to do a spot, or they've got melasma here, but maybe they might have just one big sunspot here, then we can do that one sunspot, okay? As long as it is not in that area of melasma, then you can still do that one little spot, all right? Same with if it's a vessel. If they've got melasma and you've got one vessel, one cherry angioma, yes, you can do it. But are we going to do an all over Illumi? No. Are we going to do an all over rejuvenation or a pigmentation treatment? No. But we can still do hair removal and we can do a spot treatment, not in the area where it is. Okay, so hopefully that's okay for everyone. Also with PIH. Now, PIH is caused by inflammation. So if we're trying to do that treatment and we're just trying to mop up PIH, we could effectively make it worse, or we're not going to get a result. Now, if we're doing it with an acne setting is slightly different because it's a really low level of energy. So that is okay when you're doing an acne service, but not to treat for a pigmentation service. Okay, so melasma, just to recover melasma, most of you know what it is, but it's usually from hormones. Generally, it comes up if you've been on the pill, if you have been during pregnancy. Sometimes some medications might bring it on. Generally, it will go away after pregnancy, but unfortunately, sometimes it does stay. And sometimes it's really hard to determine if it is. Now, if you have some type of skin analysis machine, they're really fantastic at being able to see deeper in, and we can really see if it's melasma. Melasma is always symmetrical. So it usually looks like a butterfly effect, or if it's here in one spot, it's here in one spot. So same things, it will be symmetrical. Sometimes it's just that line across the top of the lip as well. So if you can try and see what it is, if you can't get under those lights, really have a look at it. Ask your client questions. When did it come up? When did they notice it? Does it flare up at any specific times? So if it came up during medication or pregnancy and things like that, it's more than likely going to be melasma. And if it sort of comes up and it comes up and it's symmetrical, but then fades in the winter, it's probably still melasma as well. Same thing with your post-inflammatory hyperpigmentation. We want to really be careful with this, just so we don't make sure we flare that up as well. So both should not be treated with a laser or IPL due to the risk of increasing pigment in the area. You do not want your client to come back and say you made it worse. So these are some examples of melasma. You can see that they are very symmetrical along the lines across each sides of the face, and we do not want to treat these. I know we're tempted, but we would choose things instead like peels or microneedling are our best choices for those. So how does it work when treating pigment? So when we get our sun exposure, this results obviously in a darkening of that skin. So we get our freckle or our sunspot, and then we're going to be able to thermally destroy that pigment area with our IPL. So what we are going to do is our lesion can get darker. So that is normal. That is what we want to see. So how we know we have got it successfully is it will darken. And that's why sometimes it's really hard sometimes to see if it's darkened, because it might only darken just slightly, but before and after photo is ideal. And it can take a few minutes to darken. So sometimes I'll do my 650 all over, and then I'll go back over and have a look and see, okay, what has slowly started to darken and what hasn't. Gentle erythema in the skin is normal. Microcusting of the lesion will occur the following days. Now, remember, I don't want it to occur the day and straight away. I want it to occur in the following days, and we definitely don't want to see a block mark. That'll eventually flake off and get that miloing-like effect, and there'll be little, it'll either be completely gone or little to no response in the skin, or sorry, little to no freckle left on the skin. Now, this is a before and after. So this is before we can see these sunspots. This is immediately after, and this is 1 week after. Now, I love these before and afters for a number of reasons. One, we can see that we have a week later, it still hasn't completely gone. Some has completely flaked off, and you can see that it's miloed and darkened, especially in this spot here. But that will still be flaking away, which is why we need to wait 1 to 4 weeks, or we'll always wait, 4 to 6 weeks, but it could take 1 to 4 weeks to flake off. But the other thing I want to draw your attention to is look at the overall health of that skin. The skin clarity, the collagen therapy that we've introduced into here, we have really remodeled this hand. So it's been almost this age management thing than just a wrinkle reduction. So fantastic treatment, even across, you can even see this one through here has lightened dramatically. Those ones have almost gone. So fantastic, not only for pigmentation, but also skin rejuvenation. So again, our explanation to our clients. So the pigmented lesion will absorb the light, which will cause them to heat up. The heat created damages the cells containing the melanin while causing minimal damage to the surrounding skin. Following the treatment, the damaged lesions will turn dark and will cross off, and over the following 1 to 3 weeks, they will gradually flake away from the skin, leaving little trace of the original mark. So remember, put these in your own words. So it might darken, so it's going to absorb the heat. It's going to help to break up that lesion in the skin, and then it's slowly going to crust off the skin. Like, it may be even a much more simple way of wording it, depending on who you've got in front of you, but really work together and write those little things down. So number of treatments required. So typically 1 to 3 treatments we need, and we want to make sure that we're really minimizing the risk of that sun exposure. So we want to make sure that we are not using any fake tans as well, because if we try and treat someone who has a fake tan on the skin, we're going to pick up that fake tan. We're also going to pick up that surrounding natural tan that could be on the skin as well. So really limit your sun exposure in here. And we also don't want to repigment that lesion we just broke up. And we want to do these typically every 4 to 6 weeks. So we can see here that before and after on one hand only, and look at the difference that that has made with that before and after. That is a tremendous, not only of the pigment, but also the skin health as well at the same time. So that is phenomenal. I'm just sending some pictures to Kim to be able to bring up on the screen afterwards. So bear with me. Done. Okay. So let's have a look at our pigmented lesions. So before and after one treatment. Now, this is amazing. And I love doing pigmented lesions and getting that one result. It will just really darken and then it will start to crust away and come off. So you can clear in one treatment. Depending though, how deep it is underneath. It may be quite deep underneath. We might reduce it the first time and then that next little bit needs to come up and then we can hit it again. So this is before and after one IPL treatment. Like her skin looks good beforehand, but she does have a lot of unevenness in there. And this is really going to help to give it that beautiful, flawless finish and that really even skin tone. Now, remember, if in doubt, do not treat. So when treating any pigmented lesions, we want to consider our A, B, C, D, E. So is it asymmetrical? Is it, well, let's look at the borders. Is it outside of the borders? What color is it? Is it an uneven color? Is it two-toned? The diameter, is it bigger than 6 millimeters? Is it evolving? So is it changing over time? If the answer is yes to any of these, we refer on to a doctor or a specialist to get it checked first before we say, yes, we can do our treatment. Okay, any questions on pigment? Was there any questions? Are we good? Okay. Cool. So let's have a look at our IPL and acne treatments. So we have our different grades of acne here, and I know we all want to get in and attack those other two and clear out all of that congestion, like who's sitting there excited going, let me add it and start extracting. But we need to know what we can work with and what we can't work with. So our general grade 1, our mild acne. So this is, we will probably see mainly 1 and 2 come through our clinics. So we're going to have the smallest form of our blackheads. They can really be felt, but not so much seen. So it can be more just that real underlying congestion. Then we've got our grade 2. So this is probably the most common one we're going to see come through. So also known as acne cosmetica. So there's small blackheads, could be concerned by different open and closed comedones in here as well. There might be a little bit more oil flow. You might get the odd breakout every now and then, the odd pustular acne, but these clear up really well with lots of extractions. And then grade 3, so we've got our acne vulgaris. So this is more typical, our typical acne that we will see here, and you'll have a lot of congestion. So you'll have a lot of that P. acne bacteria. You'll have a lot of acne lesions. There'll be lots of blackheads, pustules, papules, everything like that in there as well. We really need to make sure that we are treating this one carefully, because if we're over extracting or extracting correctly, then we're going to risk spreading that internally in, and that's when you can start to see more pop up. And then grade 4, our cystic acne. So this is our most severe form of acne. So you have a lot of papules, pustules, cysts. You will get a lot of that tunneling through there as well. It is nodular. It is painful. It is sore. And we do not treat this one. This one is way out of our scope. You want to refer on. And I do know of someone who, not a Lynton person, they didn't go to a Lynton person, it was before we actually had Lynton, is they had this acne, grade 4, and they went and had spent all of this money at a clinic who said, yes, we can clear it with our skin rejuvenation and acne settings. And it was the most excruciating, painful treatment that they've ever had done. And they did a whole course and they had 0 result. So this is out of our scope. We are not going to get the results with this one. This is when you have to refer on. They do have to go to a dermatologist. They will probably need Roaccutane at this point. I know we don't like to always recommend Roaccutane, but it comes to a point where it sometimes is necessary for a lot of clients. So IPL is most effective for our grade 3. We can get improvements on grade 1 and 2, but we will have no effect on grade 4, and we will not treat it. We'll refer that on to a dermatologist. So how it works when we're treating acne. And I'd love to know who's actually done our acne settings on any acne clients. I'd love to know if you've done that, because I know a lot of people still don't use it for acne. And so Chelsea's done it fantastic. Chelsea, did you get great results with your client? I'd love to know if you did as well. So when we use this for acne, so acne has been known for some time that it is a photoresponsive condition. So with our shorter wavelength that we're using, because we're using our 585, this is going to destroy that P. acne bacteria. And we know that LED can also help to destroy that P. acne bacteria, as well as our some of our skincare products that we use. So red and infrared waves directly target the overactive sebaceous glands, and only intense pulse light systems can deliver wavelengths that target both the bacteria and the sebaceous glands. So when we're targeting both, what we're doing is we're targeting that P. acne bacteria with our wavelength, but we're also putting that bulk heating in the skin as well, and we're shrinking and closing those follicles. So we're helping to shut those down as well. So that mild heat that we're putting in helps to shrink those sebaceous glands. And as we're shrinking those sebaceous glands, we also help to tighten and close those follicles with our collagen induction. So we're hitting it from both angles. So we get a really fantastic result when we do that. So how it's working in the skin. So we're destroying that P. acne bacteria, that collateral damage or that shrinkage of our sebaceous glands as well. We've got the reduction in the sebum production. We've also got that pore tightening from the collagen stimulation. We've got the improvement in the discoloration as well. So we get that real even skin tone. Because we're putting that sort of bulk heating and that general stimulating of that new healthy cells, we do also help to clear and even out that skin tone. And then we're going to get a mild improvement of mild acne scarring. Now, are we going to get rid of pitted scarring? No, we need to take that to the next level. But if we can clear that P. acne bacteria and shrink those sebaceous glands and get that all under control, then we could move them on to a different modality where we're going to be able to target that acne scarring. So actions that we want to see in the skin, the reaction we want to see is some general erythema. We want to see some slight swelling. Now, this is usually if they're on the cheeks, you'll see that swelling a little bit more on the cheeks there because it's a little bit more sensitive. And warn male clients that hair loss may occur in the treated area and they need to shave before a treatment. Remember, we're using our 585. The 585 targets pigment. Hair has pigment, so you could potentially either get hair loss or just a stunting of the growth. So if they are happy with that, proceed. If they do not want that, then don't proceed. So it doesn't always happen, but it can. But sometimes men will just go, I don't really care. I'd rather the acne be gone and I'll be shaving it off anyway. So that's up to them, but make sure you have that conversation with them. Typical, you need 6 treatments with top up. So if they have a flare up, because depending on what it is, you need to work out what the trigger is and get that under control first. And best results are seen in a combination with our fruit acid peel. So definitely I would always do an acne treatment. I'd cleanse. I'd do it like an Illumi with the cleansing, the peel, and then using our acne setting and then the light soothe afterwards with your sun protection. Typically every 2 to 3 weeks, because we are working on more gentle bulk heating in the skin and we're not targeting a vessel or a pigment, it can work similar to like the skin rejuvenation on the 650, and we can do those closer together as well. And as well as we really want to control that P. acne bacteria and that oil flow. So if we keep working on it a lot smaller time frame, we're going to get a quicker, faster result for our client than if we space them out every 4 to 6 weeks and we're leaving it that real long time in between. So we want to keep that cumulatively effect on the skin. Now, this is after 4 sessions of it, and you can see it's quite inflamed underneath. And we've really reduced that. And we've also reduced a lot of that redness through here. We still do have some redness, but we've reduced a lot of that and also helped to minimize that scarring as well. This is after 4 treatments, and this was with the peel. You can see also the pore size, the clarity, the tone, the texture, the acne lesion count, everything is reduced on that one. And this is after 3. I think a lot of you will see this client walk through the door. And a lot of the times you won't think to use your IPL with this one, but don't discount it. See where their skin level's at, and maybe you might do a few sessions on this. Once you finish this, maybe you might do some deeper peels, or you might do more needling or laser resurfacing to get rid of any scars that are left over. And then this client, I feel so sorry for this client. Look how red and aggravated this is looks painful, it looks tender. Remember, this is the 585 handpiece, so it is going to color correct at the same time. So we're going to really help with all of those vessels and that redness in the skin and diffuse that, but also strengthen that collagen and that tissue on the skin as well. So we're going to thicken that up and get it nice and healthy and strong. And then this is after 5 treatments. And this looks a little bit more hormonal acne. So don't forget that we've got this for even those older clients. It's not just for teenagers, but have a look at the texture of her skin. Look at her cheek. Look at the nasolabial folds, at how much that has increased that collagen in the skin. It looks absolutely phenomenal. And that's after 5 treatments. Okay, so just to recap, and then we're going to bring up all of your case studies, and really this is where I want you guys to be as interactive as you want and ask lots of questions. So 650, we've got our hair removal, our skin rejuvenation, and our lumifacial. Now, if we've got our 585, we've got our vessels, our pigment, our acne, and our lumifacial. So remember, the 650 is a bit more gentle. It's got great for that hair removal, but putting that bulk heating into the skin. And then we've got that 585, where it's more of that color corrector. Okay, so that's how I like to look at it. Am I color correcting, or am I stimulating more collagen in the skin? Is which one I'd choose my lumifacial for. So, is there any questions before I get into machine maintenance? Don't think there is. Okay, cool. All right, so let's look at machine maintenance. So when we are looking at caring for our light guides, we want to make sure that we're only ever holding it from the side where the black is. We don't want to hold it from the crystal or underneath, and especially the underneath part, the metal part through here. If we hold that through there after the treatment, it's going to be hot. And the chances of you dropping that or damaging it then are quite high, because it's quite hot through there. So always buy the black on the side. And we want to never immerse it into water. So we want to make sure that we just wipe any excess gel off with a tissue, and then we're alcohol wiping it, waiting for it to dry for a couple of seconds first before we put it back into its holder. Because if we put it back in wet, it will get some of those black fibers across it as well. Now, if there is a chip in your block, what that means is when the light is coming out, that light scatters more and it doesn't come out nice and evenly where we want it to do. That chip will make that light scatter and reflect off. So just be careful that you don't have any chips on it, or if you do, maybe look at getting them replaced as well. Always check your hand pieces. So when you have got a hand piece in your hands, before you turn it on, have a look inside it. So do it before you turn it on. You want to just check that there's no scratches or anything. Remember that it's an inbuilt filter. So if there is a scratch on the inside of the hand piece, then you could be producing pure white light on the skin, and it's got nothing to block off the wavelengths that we don't want, and that could result in a burn for your client. So always just check that there is nothing there. If there is anything, you can also just give it a little wipe with a microfiber cloth is fine. We want to just check that you're not got it, and most of you will be fine, but I just want to recover some of this, that it's not sitting tucked into a little corner where there's no airflow or there's something over the top of it restricting it. It needs to have adequate airflow around the system as well. Make sure it's on a nice flat surface. I think all of you have those metal trolleys anyway, so that's perfect. Just check your water at the back every now and then. If it is low, though, it will tell you. So that is the great thing. The machine will tell you if it is low and needing water, but you'll have that little screen at the back where it has the 2 arrows, and you'll be able to see whether that is in there. We just use our deionized or our demineralized water to pop into there to fill back up again, and you'll have that little funnel to top up. Otherwise, you generally don't need to top it up. It might just be if you're maybe in a really hot, humid climate, it may need a little bit more. You will notice that some of the water will come out when you take out the handpiece, which is normal. So it just sometimes needs just a little top up. Okay, I think that is it with our maintenance. The other thing that I wanted to just go back over with your maintenance, and I'm just going to stop sharing and grab this handpiece. 1 second. All right, so when you've got your handpiece as well, so take a little blocker out. So that is where you would want to check that there's no scratches in there or anything like that. This is a very used one, so it does need a little clean in there. And then the other thing I want you to have a look at is your applicator. Just remember, when you are putting it in, it goes in straight and it may need a little wiggle. Do not put it in angled, and be careful when you're pulling it out, because I have got a few back from some people where we've had to change the flash lamps, which is normal. But some of them have lots of chips in here, and sometimes it can be like a lot of different therapists using it and they don't take as much care as you do as the owners. So just really be careful to not break those and put it in at straight, not at an angle, and don't yank it. Make sure you press the side to get that out nice and easily each and every time. So these, they are quite durable, but they can break if they are misused as well. So I think that's all I have on that. Thanks, Kim. Is there any other questions that anyone has before we go into case studies? And did Danielle say we could use her pictures?
Oh, I haven't seen a comment.
Is Danielle on? Danielle, Denise sent over some pictures for me last week. She said, yes, perfect. So, okay, so we're going to share those pictures. So I might stop sharing. Oh, I've already stopped sharing. Kim, do you want to share?
Sure. So we're going to go and show Chelsea Marie.
Chelsea Marie's first. Yep, perfect. Okay, so we've got here a client. I'm going to see, hang on a sec. Let's see if I'm really good with technology for the moment. Now, Chelsea, I've got you on twice, and I don't know which one you are, but I'm going to allow them to talk, so that way you can tell me a little bit more about this client. So I have
can you hear me now?
Yeah, I can hear you, yeah.
Okay, so this client has come in. She's had IPL done all over her body before. And we're doing Illumi on her face, neck and neck. Yeah. And then she's wanting now her back and her arms to be treated.
Okay. All right. So Kim had a good response to this. So I'm going to let Kim talk, and then I'm going to add my little bit as well, because Kim actually responded to all of this and I loved her responses. So then I'll add my little bit.
Okay, so when I looked at this and I saw it, it does seem to me like that this client is a sun bunny. And so she's, you can see like lots of pigment, vessels, lots of discoloration. So before I would go into treatment, I would definitely check medical history-wise, make sure that we check whether she's had a recent skin cancer check, just to assess.
Yeah, she has.
She has, and they're all clear?
Yeah.
Perfect.
Yeah, perfect. And so that is when I would go in and do 650 all over to begin. And that would be 650 on skin rejuvenation, because there is a lot of target. So 585 would be really zappy for her. And she will get a lot of that endpoint, that microcrusting around all the pigment. So starting her on 650 first patch tested, before we mop up a few sessions of 650 and then patch test on 585.
So adding to that as well, definitely the 650 is where I would start. And I would just do it all over, and no, I wouldn't even spot treat with the 585. I would just do 650. My only caution is it's so heavily pigmented, and you wouldn't really, I would say this would be too large of an area to do all in one. You would definitely want it to do it with a large block and really map that out, because if you have lines through there, you're going to see that color difference where you've missed. So I would really chart that out with your white eyeliner, but you might want to also do sections. So it might be too much to do it all at once. So you might maybe break it up into 2 or 3 different areas and see how it goes. But I would just do a patch test for her in one spot first, and then see, because there is a lot of area where there's a lot of white where she's lost pigment. Yep. So I really want to see how that skin responds. So do a 650 patch test in a couple of different areas, maybe up the top where it's a little bit more heavier, and then further down where it's not as so dense. and see how she goes. But you want to make sure that she's got a sun protection on, because if she is wearing, say, even just a top with a neck at the back that's open, and you can kind of see, I'm not drawing at the moment because I'm not on my screen, but if you see that area through there, it's looking a little bit more just on the back of that neck. It's looking a little bit more intense, but also a little bit red. So she really have a little bit more fresh sun through there and then respond differently. So make sure that she does wear a sun protection on there. And do you know if she goes out into the sun and
well, she plays golf, but she wears sun protection all the time. What we've spoken about, this is damage done before, because she is that, like, she does look really pigmented in that photo, but if you were to see her, she's like, her face and everything, like, she'd be a skin type 2.
Okay.
You know what I mean? And it's just sun damage, but she is always wearing like long sleeve shirts when she plays golf. When she's out walking, she wears like the whole hat, everything, sunscreen all the time.
Perfect. Good.
Yeah.
All right. And she doesn't go off swimming and things like that. And okay, perfect. Great. All right. I'm happy with that. Are you happy with that, Chelsea? Do you have any more questions on this one?
No.
Okay, perfect. And I think there was a couple of others. Was that right? Yeah.
Yeah, this is her hand and arms now.
Okay. So the only thing you have to be really careful with the hands, and the hands, like, you can tell there's a lot of pigment in that area. It's quite dense. It's quite tight. Now, sometimes that can be too much and it can burn someone. So it can be just really traumatic. If you were to still do this, I would definitely do 650. I would change to the medium block, not the large. And I would work above what you're supposed to. So we'll work above the Fitzpatrick. So if you're saying she's a 2, I would actually put her at a 3.
It's a 3.
Just because it is so much, and maybe increase your delays and pulses just to really allow that time to clear. Because even though, yes, she's wearing sunscreen, I don't know if she wears gloves when she plays golf, but they will take so much sun damage, and it definitely looks darker compared to the rest of her face. But because there is so much pigment, it can actually cause some bruising, and sometimes it can actually take all of the pigment out because we're picking up too much, and we can then leave her hypopigmentated, which we don't want. Yeah. So again, I would test patch, but so if she's a 2, go to a 3, and then put a little bit more pulses and delays in.
Yeah. Perfect.
Same with the arms, just test patch her. So next time she comes in for it, I'll just get her to pop in, do a couple of little test patch, because we want to just check that, because there is so much pigment, you do have the risk of causing hypopigmentation, because we're going to pull so much of it out. So we want to just patch test to make sure that that's not going to happen. I would patch test her on a small block.
Okay.
Yeah.
Yeah.
Oh, sorry. And just to add, the hands are quite, the skin looks very thin as well. So it can be a bit more intensive in treatment.
Yeah. Thank you.
Okay. And then lastly, talk us through this client.
No, that's not
yours. No. Okay, perfect. All right. So I think this is yours.
Thank you.
You're welcome. Do you have any other questions while I've got you not on mute?
No, I just, when treating the hair, obviously not on that client, but on a client that's just got some pigment spots and all that, would you go through with the 585 pigment, or start on the 650 Skin Rejuve?
Okay, so if it's just 1 or 2 spot treats, can we go back to the other picture or not? If it's just 1 or 2, so just say it's like there's just like 1 spot there or 2 spots, like that first hand that we saw in that picture, you can just spot treat. But if it is an overall discoloration, then you would want to, I'm trying to see if I've got a pigment lesion on my hand to do, you might want to only do 1, but if it is an overall like this, then it would be better to do an overall rejuvenation first, because otherwise you are going to really see that color difference. Yeah. The other thing to note, and just remember this for everybody, if you're doing back, if you're doing arms and hands, you follow the other protocols. So on your protocol chart, the very bottom that says non-facial area. So the parameters are different and they're a lot lower. So make sure you are choosing those lower parameters for the non-facial area.
Yeah. And could I also, with this client, do it as like an Illumi, like put the peel on before, or you wouldn't suggest doing that on the back and the hands?
You definitely could. Yep. After
Yeah.
you've patch tested her and she's been fine and no issue, yeah, 100%. You could definitely do the Illumi and do a mini Illumi for the hands. Yes.
Yeah, because she wants her legs. Next is that she wants to do her legs as well.
For the pigment,
Yeah.
you just need to dip her in one big pulse of light.
Oh, I know. She's one of my mum's best friends. And
Yeah.
like, so she's had the IPL before and she's like just come in at once, but her face, and then it was a neck. I should have sent through the photo of her face actually.
Yeah.
Like neck and neck, and then she's like, oh, now I want my arms and my back done, and then I want to do my legs. And I'm like, okay, no worries.
And you've had
So,
great success with her face?
I've only done one. I just did one on her. She's due back in on Wednesday. She's got a lot of vessels on her face.
Okay.
So I just, as precaution again, like obviously patch tested her as precaution, just like started with a 650, then did a couple of swat just to see if I picked up any pigmentation. The 650 didn't really pick up any pigmentation.
Yep.
But then just went back through and just did a couple of vessels, and she absolutely handled it. That was fine. So
Perfect.
I will go back and do, like on Wednesday, treat more of those vessels. I still probably will use a 650, and then I will move on to the 585.
Yeah, and then so with that hand as well, lots of post-cooling, pre and post-cooling, because it's pigment. You can do lots of pre-cooling with pigment. It's just not a lot of pre-cooling with vessels, but I would pre-cool that, keep that skin. Remember, we want to reduce that inflammation. So keep that really cool and just go higher. Even if you want to, because there's so much pigment, you could potentially do I would do 2 patch tests, one at a skin type 3 and maybe one even at a 4, just to see, because it's so heavily pigmented. And once you mopped up the majority of it, then you could go a little bit lower.
Yeah. Okay, cool. Thank you.
You're welcome.
So I just realized Chelsea also sent one more photo of
Her face probably.
Yeah, the back of the neck. So I just wanted to bring it up. Yeah, one sec. I'm just gonna locate that. Okay.
Oh, so this is a different client. Okay, talk us through this client.
So I've been doing her neck hair removal, and then I've noticed this. So I was like, oh, so I booked her in because I'm doing an Illumi special at the moment. So all of my clients are jumping on the Illumi bandwagon.
Yeah.
And so I was doing her facial. I was going to do the facial on her, and when I noticed this, I was like, oh, I can treat that as well, but I just wasn't quite sure what.
Okay. And that was always there. It hasn't come up post your treatment or anything like that?
No, it's always been there.
Yeah, you can see it runs into the back of the hairline as well. Okay, Kim, how would you approach this one?
If it's a like a birthmark sort of, then I would be cautious because it is very faint. And so the IPL light may not pick up the pig spot as well. So patch testing it on potentially my thoughts are the port wine stain setting, and just to see whether or not it picks up, because looking at the spot, there's not a lot of vascularity for the light to really see a clearance. And I would also advise that results can't be guaranteed as well, because it is so fair and faint. What do you think, Chaz?
Yeah, and then Linda's also made a comment. She thinks it looks like a birthmark, and she's had clients coming back saying it's a birthmark all in the same area. That's interesting that it's all in the same area. So if it's a birthmark and it's more pigment, we can always definitely try. but because of the amount of target, it may also need a lot more treatments. Like we can't say, yes, it will be 1 to 4. It may be something that may need more treatments in there to get rid of it. And we might lighten it. We might get complete clearance, but you just don't want to overpromise with this client. But definitely patch test it. And I think you will have some success. But to how much success to clear it completely, I'm just not 100%. And it depends on the client. But that's
Okay, cool.
Yeah, you and Lyndall are both up in the same area. I wonder if somehow everyone's related.
Yeah, well, she's never noticed it before, and it wasn't until I was doing her neck I was like, oh, I could probably get rid of that for you too, you know. And but she said she's never noticed it. Well, obviously it's on the back of her, like back of her, but yeah, she hadn't noticed it before.
Yeah.
So
and a lot of the times, because it's in the hair, you don't notice it.
yeah.
Okay, and then Lyndall, that's really interesting, Lyndall, that you have one on your scalp and it's from when you were born and coming. Okay, that's really interesting. All right, well, try it and let us know how you go. I think we'll all love to know. We can share that with everyone.
Perfect. Thank you.
You're welcome. Okay, and Danielle, I'm just going to unmute you and allow you to talk so you can talk us through your settings or your client. So can you hear us, Danielle?
Yep, I can hear you. Can you hear me?
I can. Thank you. Thank you for letting us share these because I think they're great little cases to be able to discuss. So talk us through this client. What have you established with her medical history, Fitzpatrick, and what are you wanting to achieve with her?
Okay, so no red flags with her medical history at all. She, obviously has got the vessels in the cheeks, but and she's got a couple of little spots on the side of her face which she would like to clear. I'm not sure whether Denise has shared like her deck pictures as well. She's quite patchy on her deck as well. There was she does have a little bit of pigment across her top lip that she has had for a long time, and there was question of that being melasma, but I'm just not quite sure about that.
Yeah. Does it look uniform on both sides, or is it just a spot?
It's just, have you guys got like a front on picture of her rather than a side on?
Bring it up.
Yeah, we'll just grab that in 1 second. Okay.
Yep, so if we zoom in, yeah, she probably does have a little bit across her top lip there.
And when we questioned more about that, what did we notice? Because sometimes it's not melasma, like sometimes, especially on the top lip, if they've had like lots of waxing done as well, and then they've gone out in the sun, and that can pigment from that trauma to the wax and going like that. So sometimes the lip can be kind of hit and miss a little bit.
Yeah, so she doesn't have anything else on her face that would make me red flag it as melasma, and she is a waxer, like she's a full face waxer. So that could quite be the possibility. But initially, when I shared this image, it was a concern of a little melasma over the lip. So we'd sort of, red flagged the IPL treatment at all for her. But, I would like to be able to diffuse a bit of that redness for her.
100%.
Yeah.
What does everyone who's on today, what does everyone think? Would you put this in the melasma category, or would you put this into it is still okay? I'd love to see what everyone else is thinking as well, because I think she would be great for an all over 650 and then start to spot treat, because if you tried to treat all of those vessels and pigment at one time, it's going to be a little bit painful. So I would definitely do a 650 Illumian spot treat.
Initially, I was so excited for her as a client because, she's such a good candidate for it. But then I was sort of told that maybe she may not be a good candidate because of, the top lip. So, and then I went through the disappointment stage going, oh my God, I can't treat her, blah, blah, blah. But yeah, so.
Kim, what do you think? I'm not sold on the melasma because I can't see it anywhere else, and it's only that top lip. And I'm thinking,
when I showed Denise as well, Denise was like, no, she's definitely a candidate. So
yeah. And do you have any do you have any skin scanners or anything like that that you can know?
I
So
don't.
Lyndall, I think it is, has put down see a dermatologist first to make sure, which is always
Yep.
a great idea, just to refer and make sure, because this one can go either way. She could potentially have it and we're only seeing it here, or it could just be some type of trauma that she's had some from treatments or something like that, or over the years of sun, because that does take it. Is she a smoker?
She used to be, yeah.
So I'm thinking I can see the lines through there, and that smoke would have been sitting there as well a lot and causing a lot of
not
damage.
currently. So she has kicked the habit.
Yeah, perfect.
Yeah, which is a huge positive.
Yeah.
But and has obviously been quite a sun bunny back in her.
So I would see if she
day.
can either go to a dermatologist and get that overall clearance, or as well get see if we can go under a skin scanner and also have a look and then see what's happening. But yeah, get the clearance first, and if it is all cleared, because unfortunately you won't know until you start treating it, and then it's like it's too late. But if she does get the all clear 100%, I would go in at the 650 and spot treat, get those bigger vessels and pigment spots to start. You might do 2 650s all over first with clearing up those bigger vessels, and then you might go into the 585 skin rejuvenation and do that, and that will pick up the majority of it as well.
Yeah. No, that sounds good. It's just so hard for us out here. Like we actually only have a visiting dermatologist that comes once in a blue moon, and they're very, very hard to get into. So,
even if she sees her doctor, the doctor and asks those questions. Look, some doctors are great, some aren't great, but you can always start there with that starting point and then have a look and see, and get some guidance from them. But I kind of want to sit more on the other fence that she's fine with it.
Yeah, that's where Denise was. So
and I would even just maybe do a couple of test patch on those bigger ones. And see how you go with that. But because I can't see anything here, everything up here looks
there's nothing. She's just got a couple of patches, probably more so on the right hand side of her face, that are a little bit darker. Maybe if you flick to back to the image that was, you can see one down near the jawline there. She's got a couple of little patches down here.
And it's definitely not on the other side?
There's one a bit higher on the other side, I think.
It's not the same. Yeah, it's different.
Yeah, it's different.
I would want to get this one client checked and cleared first, but I think you would definitely be fine with like those big vessels where Kim's hand is. So they go up a little bit higher, Kim, just under the eye, that pigment. I think like clearing up that one should be fine to clear up, and maybe a couple of those vessels on the cheek would also be no problem to clear up while you're waiting to see if you can do an overall, but those ones would be fine for you to be able to treat through there.
So you think would be okay to just go ahead and do at least some patch testing and see how
I would
goes?
say, look, let's get her to go to a doctor and get that cleared first. But you can probably just patch test those 2 spots. Don't go patch testing everything, and just patch test those 2, get her in for a doctor before you do a full treatment.
Okay.
And is she on a sunscreen now and looking after her skin?
Yeah, she is. I was saying to Denise, she's actually got one of those. It's not I'm just trying to think of the name of it. Oh, the Omnilux LED facial mask.
Those. Okay. Yep.
So she's got one of those, and I have actually seen a really nice difference in her since she's been using that. She uses it daily for 10 minutes. So in terms of skin prep, she would be amazing.
Fantastic.
All
right, that's good. Perfect. Was there any of this one client that you sent through?
Sorry?
Was it only just this one client that you sent us through? Okay. Did you have any other questions while we have you?
No, all good. Thank you.
Perfect. All right. Does anyone have any other questions that they would like to be unmuted for? So let me know and I can unmute you. Cool. That's good. Loving it. Okay. So with our Lynton, I just want to make sure that everybody is feeling comfortable with the different settings, different parameters, when to accelerate. So when we do our treatments as well, we do want to elevate. So we want to make sure we are elevating each treatment as we go on, because remember, our target in our vessel is going to get smaller and smaller and smaller each time, or get lighter. So we need to make sure that we are elevating that treatment. So remember to patch test for a little bit higher up each time, increase that fluence. That way we can get more energy into that smaller target, because the smaller the target, the more energy it's going to need. Remember that if we are concerned about putting a high amount of energy into something, and we've got a darker skin type, we do want to put more pulses and delays in there to break up that energy level, so that way we are heating up that target, but we're not compromising that skin at the same time. So make sure that we are keeping that skin and that thermal relaxation, but also that destruction level. We want to keep that all safe at each and every time as well. So I think we've gone through everything. So unless anyone has any more questions, I think we'll probably be finishing up a little bit earlier today, but I think going through those case studies were really good. Remember, if you do have any other case studies, just send them straight through to the education team. So education@probeauty.com.au. It's much easier to send them through to there than to your business development manager or to one of us directly. Remember, there's the whole team, myself, Kim, Rachel and Heather are all here to support you, and we all access that one inbox. So please send everything through to education. If you have a question and you do want us to help guide you on those protocols and parameters, send through as much information as you can. Photo is great, the consultation forms and background on your client. If you've done any treatments on them before, that's also very helpful as well for us. So please send those all through. Thank you so much for joining us over the last 2 weeks. It has been absolutely fantastic, and I've loved working with everyone again. So until next time, but please always reach out. We're always here. Have a great week, guys, and hopefully we'll all see you at Skin Summit. So make sure you're all coming to Skin Summit. All right, see you guys. Thank you.